They fired the rookie nurse for helping a veteran's K-9, and then, minutes later, Navy SEALs stormed the hospital. If you've ever watched someone follow the rules while your life quietly falls apart, ask yourself this when pain is right in front of you. Do you hide behind policy, or do you act? It's past midnight in Norfolk, Virginia. Tidewater Memorial's ER is packed fluorescent lights buzzing over blood-streaked gurneys and ringing phones. A wheelchair rolls in carrying an older man with combat posture and tired eyes. At his side, a German shepherd drags a hind leg teeth bared, shaking with pain. Staff step back. Liability hangs in the air like smoke, but one new nurse kneels anyway. Stay to the end to see what her calm touch exposes. Like the video comment where you're watching from. Wherever you would have been standing in that emergency room, the bark would have sounded the same. It did not come from fear. It came from pain that had nowhere to go. Tidewater Memorial sat under a sheet of rain, its glass entrance glowing against the dark streets of Norfolk. Inside, the air tasted like disinfectant and burnt coffee. Phones rang without mercy. A monitor near Trauma 1 chirped a warning that nobody answered fast enough. People pressed forward at triage with the same look in their eyes, not anger, but need. Nurse Lila Bennett moved along the edge of the crowd with a clipboard tucked against her ribs, shoulders turned sideways so she could slip past elbows and stretcher rails. Her scrubs were still too crisp, her badge still bright enough to catch the fluorescent glare. 6 hours into her shift, she already felt as if the night had stretched into something that did not have an end. Bennett, the charge nurse, called, voice hoarse from shouting over noise all evening. "Triage, now." Lila nodded and cut down the hall that smelled like bleach and wet cloth. A gurney rolled past, pushed hard by a tech, with sweat shining on his forehead. The man on it clutched his side eyes wide, lips pale. "Knife," the tech said, not looking up. Lila stepped back to let them through, then kept moving. The ER swallowed the gurney whole. On the wall beside the triage desk, a laminated sign showed a cartoon dog with a red circle and slash. Under it, smaller letters spelled the exception, service, animals allowed, animals not receiving treatment. Leela had sat through the orientation lecture 2 weeks ago, listening to a risk manager explain it in the calm language of lawsuits. Do not touch an animal. Do not accept responsibility for it. If a patient arrives with a working dog, confirm it is working and keep it with the patient. If an animal is injured, refer out. If an animal becomes a threat, call security. The risk manager had not been unkind. She had been practical. She clicked through a slide that showed a security camera still frame a blur of movement. A dog's open mouth, a staff member's raised forearm. Another slide listed costs, not human ones, but numbers with commas. Settlements, legal fees, lost time. She spoke about duty of care and scope of practice, and the thin line between compassion and exposure. Then she looked around at the new hires and said, if you feel bad about a rule, remember this. The rule is there because someone got hurt. Leela had written the rules down anyway. She wrote everything down because being new meant one mistake could follow you. She was still paying off school. She was still on probation. She was still learning which doctors wanted facts and which ones wanted deference. She had learned that some nights you kept your head down simply to keep your license clean. You became the nurse who showed up, did the work, and disappeared back into the flow. But the lecture had not covered what to do when a working dog came in limping, not as a visitor, not as a symbol, but as a living creature with pain in its joints. The policy did not explain what to do when a handler refused to leave because leaving would mean betrayal. The policy assumed the world stayed tidy enough for referrals and business hours. Tidewater Memorial did not run on business hours. Rules felt clean because paper never had to listen to a patient trying not to scream. Tonight, triage was a conveyor belt of small disasters. A sailor with a split palm from a busted engine hatch. A woman with a swollen ankle, wet jeans clinging to her leg. a teenage boy shivering with fever cheeks burning red. A man in a hoodie coughing so hard his lips went slightly blue until Lila coached his breathing and walked him to a chair. She moved from one to the next, checking vitals, giving short reassurance, handing off to respiratory and imaging, keeping her tone steady, even when her feet ached and her throat burned from dry air. Norfolk nights brought ocean damp into the hospital salt on clothes, wet boots, military haircuts, and the quiet exhaustion of people who worked through pain. The naval base was close enough that you could feel it in the hallways. You saw it in posture. You heard it in the way some people spoke, clipped and controlled, as if loud words were weakness. When the wheelchair rolled, in the triage clerk's first instinct was not cruelty. It was survival. A dog in the waiting room could turn into panic in seconds. Panic could turn into a fight. Fight slowed the whole department, and the department was already choking. The clerk had seen it before. A shouting match between families that ended with the security at the doorway. A drunk patient swinging at a tech. A man with a broken jaw spitting blood onto the counter because he was tired of waiting. Each incident stole attention from the people who were quietly dying in rooms behind curtains. You could lose 30 minutes to one bad scene. 30 minutes was a lifetime in an ER. That was why the clerk's eyes kept flicking to the dog's teeth. She was not judging Ranger's worth. She was calculating what his presence could cost everyone else. The math was brutal and immediate: one bite, one panic, one fall, one lawsuit, one night where the whole unit got dragged into reports instead of care. Lila understood the clerk's fear. She still watched Ranger anyway. The chair came through the doors, pushed by a security guard who looked like he regretted touching it. The man in the chair was older and wiry shoulders hunched under a faded brown jacket. A navy baseball cap sat low, rainwater dripping from its brim. One hand clamped a leash so tight his fingers trembled. His other hand rested on his thigh palm flat, as if he was holding himself in place. The wheelchair was not one the hospital owned. Its frame was scuffed, the footrests worn smooth, the kind you see outside the VA clinic across town. Mud dotted the tires and water dripped from the spokes onto the tile. The man's face was lined, but his eyes were clear, scanning the room with the same discipline the dog showed. He kept his shoulders square even while seated posture that did not come from comfort. It came from habit. He spoke to the dog without looking down, voice low enough that only the dog could hear it. "Stay with me," he murmured. The leash did not slacken. The grip was not about control. It was about contact, a lifeline made of leather. Beside him moved a German shepherd, not a pet, not the kind that wandered up to strangers for attention. His head stayed level. His eyes tracked every person in scrubs with cold, focused precision. A thick harness hugged his chest, dark with rain. A patch sat on the side, damp and hard to read, but Lila caught enough to feel a small jolt. Military working dog. The dog's left hind leg dragged. No blood, no open wound, just a hitch in the hip and the way his paw landed wrong, careful and furious. He barked once deep and hard, and the waiting room flinched as if someone had slammed a door. A child started crying. A nurse froze with a pulse oximeter in her hand. The security guard pushing the chair slowed as if he expected teeth. The clerk leaned forward, voice soft but urgent. "Sir, I need you to step back outside with the dog. I can call someone." The older man did not budge. "He's trained," he said, voice steady but worn at the edges. "He won't hurt anyone. He's injured. Please." A triage nurse named Monica stepped closer, palms open, eyes on the dog's mouth. "Tell me what happened," Monica said. "He went down," the man replied. One step and his leg folded. "He's been favoring it for 2 days. Tonight he stopped putting weight on it." Monica nodded, then asked the question she had to ask. "Any pain meds?" "No," the man said. "I don't guess with him." The dog's breathing hitched as someone nearby coughed. His head snapped toward the sound, then back toward the chair body, tightening as if he might spring. The man lowered his voice. "Ranger, eyes." The dog turned back to him immediately, jaw still tight, posture still defensive but redirected, training deep enough to work even through pain. Monica saw it. She glanced toward the physician in the hall as if hoping that detail would matter. The clerk tried to pull the moment into the system anyway, fingers already hovering above the keys. "Sir, date of birth." The man did not look at her. "April 9th, he said, 1951. The clerk typed fast, then hesitated, eyes flicking to the dog like she expected a field on the screen to appear for him. There were codes for everything, not for this. A young resident stepped out from the back hall and stopped short at the sight of the German Shepherd. He looked at the physician in the corridor, waiting for permission to breathe. The physician gave him nothing but a small lift of the chin. "Stay back." The resident stayed back. Discomfort spread through the waiting room. People in pain do not like reminders that pain can bite. A man near the vending machines muttered, "Get it out," and someone else answered, "It's hurt," and their voices died when Ranger barked again. Creed's voice carried from the corridor, clipped and confident, the kind of tone that told the room the decision was already made. Lila saw Monica's shoulders tense as if she wanted to argue and knew it would not land. The clerk's hand hovered over the security extension. The guard behind the wheelchair adjusted his stance. The dog responded to every shift of body language, reading intentions faster than the humans who wore them. Dr. Malcolm Creed ended a phone call and turned. Creed had the kind of face built for authority. Hair cut short, jaw clean, white coat still pristine in a room that was drowning. He stopped at the threshold between the waiting room and the clinical corridor as if he could decide who crossed. His gaze locked on the dog first, not the man. "We do not treat animals here," Creed said. His voice did not rise. It cut through noise anyway. "This is a civilian hospital," he added. "Remove that dog now." The dog's teeth flashed not in a bite, but in a warning. He planted himself between the wheelchair and Creed's stance, wide body low, breath fast through his nose. Lila felt the air tighten, that sudden pressure when a room knows it is one wrong movement away from disaster. The man in the chair raised his chin, a small movement that still looked like command. "He's not aggressive," he said. "He's hurting." Creed took a step forward and stopped. Hands folded at his waist, voice calm. "Pain does not change liability," Creed replied. "If that animal bites someone in this facility, we are responsible." A nurse whispered near Lila, "What if it has something? It's a military dog." Another hissed back. Still, the dog's eyes flicked toward the whisper and back to the man in the chair, as if that was the only safe anchor. Lila stayed half behind a medication cart someone had left in the wrong place. She watched the dog the way she watched unstable patients, breathing too fast, muscles braced, eyes not scanning the room for prey, only tracking threats to one person. Guarding, she thought, not hunting. The man's hands trembled, but he did not let his voice shake. "I need a doctor," he said, "for him." Creed's expression did not soften. "No," Creed said. "For you. You can be evaluated. The dog cannot stay." The words landed like an insult dressed as procedure. The man's throat worked as he swallowed. "He served," he said, not loud enough to demand attention, but enough to gather it. "He served with me." A paramedic paused mid-step. Even the security guard pushing the wheelchair slowed. Creed exhaled through his nose, impatience controlled. "That may be," he said. "But this is not a veterinary clinic. We do not have the equipment. We do not have the staff. We do not have clearance. Remove the dog." The security guard cleared his throat. "Sir," he said to the man, "can we take him outside? I can call animal control or a vet." The dog lunged half a step, jaws snapping at empty air. Not trying to connect, just drawing a hard line. The guard recoiled, hand dropping toward his radio. The man's voice cut through quiet and sharp. "Don't." The dog immediately held the position, muscles trembling, eyes still fixed. Obedience under strain. That obedience tightened something in Lila's chest. The harness was not cheap. The metal rings were built to take weight. The nails were clipped short. The coat was clean, beneath the rain brushed and cared for. The dog's eyes were intelligent, furious, and clear. The man in the chair did not look like someone who came to hospitals often. His jacket was worn at the elbows. His hands carried pale scars across knuckles and fingers, the kind you get from hard edges and hard work. Beneath his sleeve, the corner of a faded tattoo peeked out dark ink, worn by years. He looked like a man who avoided help until he had no choice. A senior nurse brushed past Lila and muttered, "This is why we don't allow animals." Another whispered near her shoulder, "Don't get involved. Creed will eat you alive." Lila did not answer. She simply kept watching because watching was what you did before you chose. The charge nurse appeared behind Creed's face, shiny with sweat. "Doctor, we've got 2 ambulances inbound," she said, "and we're already full." Creed did not look away from the dog. "Then we do not have time for this," he said. Lila heard what he did not say. This was not just about time. It was about control. The ER was already drowning, and the dog was something they could not chart or medicate into compliance. The triage clerk tried again, voice thin. "Sir, if you need to be seen, I have to register you." The man reached into his jacket with slow care, like sudden movement could turn the room violent. He pulled out a worn wallet and held it up. "My name is Elias Harlan," he said. "I'll sign whatever you want. I need his leg checked." Creed's eyes flicked to the wallet and back. "Mr. Harlan," he said, "I can evaluate you. I cannot evaluate a dog. That is the end of it." Elias's voice stayed calm, but something sharper ran under it. "I'm not leaving him," he said. The words were not dramatic. They were final. Security shifted. A second guard moved closer, radio crackling. Ranger's lips peeled back, a warning held in place by discipline. Creed lifted his chin. "Sir," he said, "if you refuse to comply, we will escort you out." Elias smiled once without humor. "You can try," he said. Lila's eyes dropped to Ranger's hind leg again. The way he held the hip. The slight swelling near the joint, subtle under fur, but there. The way his toes curled when he shifted weight. Ligament, she thought. Or tendon, not nothing. Elias leaned forward, voice hoarse at the edges now. "Doctor," he said, "if you won't help him, then tell me where to go." Creed hesitated, a small calculation flickering behind his eyes. Refusing was easy until someone asked you to own the refusal. "Call a veterinarian," Creed said. "Go to an animal clinic." Elias let out a dry laugh. "It's midnight," he said. "The roads are flooding, the clinics are closed, or an hour away." Creed's eyes flicked to the weather alert on the muted television. "Then wait until morning," Creed replied. Elias's jaw tightened. "He can't," he said. "Not like this." Ranger shifted again, and his left leg buckled for half a second. He caught himself, but the sound that escaped him was not a bark. It was a clipped grunt, the kind a person makes when they refuse to cry out. Something moved through the crowd, not sympathy exactly, but discomfort. The sound was too real. Elias kept his voice controlled, like he had learned long ago that volume wastes oxygen. "If you crowd him, he will read it as threat," he said. "If you grab the chair, you will trap him. If you separate us, he will fight." It was not a plea. It was instruction meant to keep strangers safe from their own fear. Creed's gaze stayed flat. "Sir, you do not get to dictate procedure in my emergency department." Elias's eyes lifted. "And you do not get to pretend procedure is the same as judgment," he said. The room tightened again. Some people looked away, ashamed to be watching. Others stared like they wanted the tension to resolve their own fear. Lila listened to Elias and felt her own training tug at the back of her mind. Not hospital training. The older, quieter kind that taught you how fast a situation could turn when someone tried to impose control with force. She watched Ranger's mouth, the quick, dry flick of tongue, the way the dog's eyes kept returning to Elias as if his world had narrowed to a single point of duty. She noticed the tremor in the injured leg when he shifted weight. The dog was holding pain the way disciplined men held pain quiet until it became dangerous. The guard lifted his radio, ready to solve fear with removal. Elias's voice dropped into command. "Ranger, hold." The dog held. Trembling, hurting, but holding. Lila felt her heartbeat slow, not because she was calm, but because her mind had narrowed to a single line. The dog, the pain, the risk, the choice. Ranger's eyes met hers for the first time, not pleading, measuring. Layla tasted metal at the back of her throat. She could smell wet fur under antiseptic. She could hear nails clicking as Ranger fought to keep his stance. She stepped out from behind the medication cart. And the room seemed to notice her only because she moved with purpose instead of panic. "Ma'am," the security guard warned, voice tight, "don't." Lila did not look at him. Her attention stayed on Ranger's eyes because eyes told you where the bite lived. Not in the teeth, in the fear behind them. She lowered herself slowly, one knee touching the cold tile, the other foot planted, so she could stand if she had to. She kept her hands visible, palms open, fingers relaxed. No reaching, no sudden angles. Her body turned slightly to the side, a softer shape, less challenge. She let her breath out in a controlled stream and made her voice small enough that it belonged to Ranger, not the room. "Hey," she said. "You're okay." Ranger's bark cracked again, louder, sharper, a blast of sound that made the triage clerk flinch behind the monitor. His lip curled. Teeth flashed white under fluorescent light. He snapped at the air, not trying to connect, drawing a boundary. The guard's hand hovered over his radio. Elias tightened his grip on the leash. "Ranger," he said low and steady. "Oh." The dog held muscles trembling, eyes still locked forward. Pain made his whole frame look like a drawn bow. Lila nodded once, as if Ranger had just answered her. "I see you," she murmured. "I see what you're doing." Dr. Creed's voice came from behind, clipped and irritated. "Nurse," he said, "back away from the animal." Lila did not obey. Not because she was defiant by nature, but because the moment had a shape to it. If she pulled back now, Ranger would feel it as rejection. If someone else rushed in, Ranger would react. The room would turn into shouting and hands and fear. The leash would tighten, the wheelchair would jolt. A dog already hurting would stop thinking and start defending. She moved her gaze away from Ranger's eyes for half a second, just enough to take in his posture again. Weight shifted off the left hind. Hip guarded. Toes curling. Not a broken bone. Not if he could plant the paw at all. But something was wrong deep in the joint. Then she brought her focus back to Ranger and softened her face. She let the corners of her mouth settle not into a smile but into neutrality. Dogs read tension faster than people did. They read what you meant, not what you said. "Easy," she said again. "Easy, Ranger." The name slid out like she had used it before. Elias's eyes flicked to her, surprised. He did not speak. He was too busy keeping himself from begging. Ranger's barking stuttered a hiccup of sound that died halfway in his throat. His ears twitched uncertain. He did not trust easily. But he understood calm. He understood a voice that did not want anything from him. Lila lowered her chin in a small, respectful gesture and shifted her weight forward a fraction of an inch. She did not reach. She waited for Ranger to decide whether she belonged in his circle. "You're doing your job," she whispered. "You can keep doing it. You can keep him safe. You don't have to fight me." Ranger's chest rose and fell fast and shallow. A low growl vibrated under his ribs, not escalating, not fading. Suspended. Lila held still long enough that the room's noise started to creep back in around them. A monitor chirped again. A phone rang. Someone coughed. The ER kept living, but the space between Lila and Ranger tightened into a private corridor. She glanced at the leash, then at Elias. "May I?" she asked, quiet. Elias hesitated. Then he nodded once. "She won't hurt you," he told Ranger. "She's helping." Ranger's eyes did not leave Lila's hands. Lila lifted one hand slowly, not toward Ranger's face, but toward the space beside his neck. She stopped halfway and let it hover. A question. Ranger leaned forward just enough to smell her. His nose flared. He took in the scent of antiseptic sweat laundry soap and something older beneath it, a scent that did not belong to hospitals. Lila did not move while he judged her. She watched his breathing, counted the seconds between exhales, waited for the tension to shift. Then Ranger pressed his forehead forward, not into her palm yet, but close enough that she could feel heat from his fur. Lila let her fingers touch the side of his neck just behind the jaw where muscle softened. Her contact was steady, not tentative as if uncertainty might offend him. Ranger went rigid. Every person in that waiting room stopped breathing. Lila kept her hand where it was and spoke again, voice low. "That's it," she said. "That's it. Stay with me." Her fingers worked gently through dense fur, not petting, not soothing for show, but grounding. Pressure released pressure like an anchor line. Ranger's eyes stayed sharp, but his jaw loosened a fraction. The growl faded into breath. The bark did not return. Against the logic of everyone watching, Ranger leaned into her touch. A hush fell heavy and complete. Even Dr. Creed did not speak for a heartbeat, as if words might shatter what he was seeing. Elias exhaled slowly through his nose, shoulders dipping as if he had been holding himself upright through sheer will. Leela slid her hand down Ranger's shoulder and felt the tremor in the muscle. Not rage. Pain. "All right," she whispered. "Show me." She shifted closer, careful, keeping her body angled away from Ranger's teeth. She reached toward the injured leg, stopping short, letting Ranger see the movement. Ranger's ears pinned back for a second, but he did not snap. His eyes flicked to Elias, then back to Lila. Elias tightened his grip on the leash again, not pulling, just reminding Ranger where home was. Lila placed her fingertips along the upper thigh and palpated gently, reading the dog's response through muscle tone. Ranger tensed, but did not lunge. She moved to the hip, then the knee joint, testing for heat and swelling. The joint felt warmer than it should. The soft tissue around it held a tightness that spoke of strain. No crepitus, no grinding, no obvious deformity. Ranger kept weight off the leg, but could still stabilize himself when needed. Lila lifted her gaze toward Elias. "Did he yelp when it happened?" she asked. Elias swallowed. "He did not," he said. He went quiet. Then he kept moving. Leela nodded once. Quiet injuries were the ones that hid until they broke something else. She tested range of motion with extreme care, supporting the leg so the joint did not bear weight. Ranger's breathing quickened. A low sound escaped him when she flexed the joint past a certain point. Not a bark. A restrained warning that he was reaching the end of his discipline. Lila immediately eased off and kept her hand steady on his shoulder. "I know," she murmured to him. "I know." She moved her fingers along the ligament line, checking for laxity. Ranger's muscles clamped down, protecting the joint. Not a fracture, she thought again. More likely ligament strain, maybe partial tear, possibly an early cruciate issue. He needed imaging, but he also needed the pain taken seriously. Lila looked up and spoke with professional certainty, the kind she had not yet earned in this building but carried anyway. "Soft tissue injury," she said. "Likely ligament strain. He needs stabilization and imaging. Anti-inflammatory medication would help, but he should not be walking on it." Dr. Creed stepped forward sharply. "You are not a veterinarian," he said. "You are not authorized to assess an animal." Lila kept her hand on Ranger's shoulder. She did not turn her head. "I'm not making a veterinary diagnosis," she replied. "I'm assessing an injury so he stops escalating." "That determination is not yours to make," Creed snapped. The charge nurse voice, tight with stress, tried to mediate. "Doctor," she calmed him, Monica said. "He's not barking now." Creed's eyes stayed hard. "That does not make this acceptable," he replied. The security guard cleared his throat, uncertain now. His posture loosened as his brain tried to reconcile what he had prepared for with what he was seeing. Lila looked at the guard. "Can you bring me a towel and an elastic wrap?" she asked. "And ice in a glove if you have it." The guard stared. "For the dog?" he asked. "For the injury," Lila said. The guard did not move. He looked toward Creed, waiting for instruction. Creed's jaw flexed. "No," he said. "Do nothing. Nurse Bennett, remove your hands from the animal." Leela lifted her gaze toward him for the first time. Her eyes were calm, but there was steel in them, the kind that did not come from a nursing program. "If you rush him," she said, "he will bite." Creed scoffed. "You are threatening staff now," he said. "I'm stating reality," Leela answered. Elias spoke, then voice rough. "She's right," he said. "If you crowd him, he'll defend. He's still holding because he trusts me. and because she's not making him feel trapped. Creed's gaze flicked to Elias briefly, then back to Lila. Sir Creed said if you cannot control your animal, you cannot remain here. Elias's hand tightened on the leash. I am controlling him, he said, forcing the words through exhaustion. He is injured. He is scared. He is still following commands. Ranger's head stayed angled toward Lila, but his eyes kept returning to Elias, a silent check-in. Lila slid her hand down Ranger's foreleg briefly, then back to his shoulder, maintaining contact. Ranger, she whispered. Stay. The dog exhaled. His weight shifted slightly, still guarding the injured leg, but less rigid now. His tail did not wag. He was not happy. He was allowing. Lila looked at Monica. Can you get me a clean towel? She asked. Monica hesitated, then nodded quickly and disappeared into the hall. Creed's voice sharpened. Monica, he barked, do not enable this. Monica did not stop walking. The triage clerk looked like she wanted to melt into the desk. Patients in the waiting room watched with the hungry curiosity of people who have nothing else to do but witness other people's crises. A man with a bandaged hand leaned forward, whispering to his partner, that dog's military. A woman holding her child murmured, why won't they help? Lila ignored the whispers. She focused on the small, immediate steps. Keep Ranger calm. Keep Elias safe. Keep everyone else from making it worse. Monica returned with a towel and a glove packed with ice. Lila took them without looking away from Ranger. Thank you, she said. She folded the towel, wrapped the ice inside it so it would not burn the skin through fur, then moved it toward Ranger's knee slowly. Ranger's nostrils flared again. He watched the bundle with suspicion. Lila spoke to him the way she spoke to patients who could not understand her words, but understood her tone. Cold, she said softly. Helps. She placed the towel against the joint with a gentle pressure, then held it there rather than strapping it down. Ranger's body tensed at first, then relaxed a fraction as the cold began to numb the heat. Elias's throat worked. You're good at this, he said quietly. Lila's mouth did not move much when she answered. Pain is pain, she said. It reads the same. Monica hovered, close eyes wide. How do you know what to do? She whispered. Lila did not answer. She did not have a safe answer. She held the cold pack for a minute, then lifted it away, careful not to startle Ranger. She took the elastic wrap and unwound it slowly, keeping it visible so Ranger could track it. She did not attempt to bind the dog's leg tightly. She did not have the tools or time. She simply created a supportive wrap around the joint area, loose enough to avoid cutting circulation, firm enough to remind Ranger to protect the leg. Ranger watched every movement. He stayed still. When Lila finished, she kept her hand on his shoulder again, grounding him. There she whispered, better. Ranger's ears shifted. His breathing slowed. He leaned once more into her palm, the smallest surrender, and Lila felt the room's tension ease around it. Creed looked furious now, but it was a quiet fury, the kind that tried to wear professionalism as armor. Security, he said, voice clipped. Get them out. The guard's radio crackled. He glanced at Ranger, then at Lila, uncertain. Doctor, he said, he's calm now. Creed's eyes cut to him. Now, Creed repeated. Monica opened her mouth as if to argue, then shut it. In hospitals, arguments were currency, and rookies did not have much to spend. Lila did not look up from Ranger. She spoke to Elias instead. Can you stand someone separating him from you? She asked quietly. Elias's face tightened. No, he said. He'll fight. Lila nodded. That was what she thought. She turned her gaze toward the security guard. If you touch the chair, she said, you'll trap him. Let me move them. The guard hesitated. He looked at Creed again. Creed's lips tightened, but he nodded once, sharply, as if the concession irritated him. Fine, Creed said. Move them, now. Lila rose carefully, keeping one hand on Ranger's shoulder until she was fully standing. Ranger adjusted his stance weight, still guarded, but he stayed close to Elias. Lila placed both hands on the wheelchair handles and looked down at Elias. I'm going to get you out of the waiting room, she said. Slow. No sudden turns. Elias nodded, eyes glistening with something he refused to show too clearly. Thank you, he said. Lila did not answer. She began to push the wheelchair toward the corridor that led to the back exit, away from the densest crowd. Creed stepped to block the path. "Not that way," he said. "Out the front." Lila stopped. "The front is full," she said, keeping her voice level. "People will crowd. Ranger will react." Creed's jaw tightened again. He glanced at the waiting room crowded with strangers and noise and fear. He stepped aside with visible reluctance. "Out," he said. Lila pushed forward. Ranger walked tight to the chair, head-low eyes scanning. The elastic wrap held. The limp remained, but the pain no longer owned him completely. They moved down the corridor, where the fluorescent lights buzzed louder, where the ER sound shifted from chaos to the steady hum of machines behind closed doors. Monica followed for a few steps, then peeled away toward a patient call light. Duty pulled her back into the current. As Lila guided the chair toward a quieter corner near a supply closet, the hospital director appeared like a storm front. Director Keenan Rowe moved fast, suit jacket open, tie slightly crooked face flushed with anger that had nowhere else to go. Behind him walked two security supervisors and a woman from administration clutching a tablet like a shield. Rowe took in the scene with a single sweep. The wheelchair, the dog, the rookie nurse with her hands on the handles. "What is this?" Rowe demanded. Creed spoke immediately, eager to frame it. "She violated protocol," Creed said. "She touched an aggressive animal and treated it in the ER." Rowe's eyes snapped to Lila. "Is that true?" he asked. Lila met his gaze without flinching. "Yes," she said. Rowe's voice dropped sharper. "You understand you put this hospital at risk," he said. "You disregarded direct instruction from a physician." "I reduced risk," Lila replied. "He was escalating because he was hurt." Rowe's nostrils flared. "We do not treat animals," he said. "We do not assume liability for animals. We do not create precedent that gets someone bitten next week because a nurse thinks she can handle it." Lila's eyes flicked toward Ranger, who stood beside Elias like a sentry. The dog's breathing stayed controlled, the bark gone, the teeth no longer exposed. "He is not a precedent," Lila said. "He is a patient with an injury." Rowe's mouth tightened. "He is not a patient," he said. "You are not authorized. You are employed here on probation, Nurse Bennett. Do you know what this does to our insurance?" Elias tried to speak, but his voice caught. "Sir," he said, "he's trained. He won't hurt anyone. He was just hurting." Rowe did not look at him. "I am speaking to my staff," Rowe said. Elias's eyes hardened. "She is the only staff member who treated us like we mattered," he said. Rowe's gaze flicked to him for the first time, then annoyed at being forced to acknowledge a man in a wheelchair as something other than paperwork. "And you, Rowe, said we're instructed to remove the animal. You refused." Elias's grip on the leash tightened. "I refused to abandon him," he replied. Rowe turned back to Lila as if Elias had not spoken. "You are finished here," Rowe said. The words landed clean final. "Clear your locker," he added. "Badge and access card at the desk. Consider yourself terminated." The corridor fell quiet. Even the distant sounds of the ER seemed to dim for a second, as if the building itself paused to listen. Lila felt a small shift in her chest. Not surprise, not fear, but a familiar cold acceptance. She had known the risk when she stepped out from behind the cart. She had chosen it anyway. She nodded once. "Yes, sir," she said. Creed looked almost satisfied, as if order had been restored. Rowe watched her, waiting for, pleading for tears for the drama that would justify his decision. It did not come. Lila kept her posture steady and lowered her voice so it belonged to Elias and Ranger, not to Rowe. "Come on," she said to Elias. "Let's go." Elias stared up at her eyes, wet now, the last of his control slipping. "You didn't have to do that," he whispered. Lila released the wheel locks. "I did," she said simply. Ranger shifted closer to her leg, not touching, but near enough that she could feel his warmth. Rowe's voice cut in again, harsh. "You will not escort them as an employee," he said. "Security will handle it." Lila looked at Ranger, then at the security supervisor. The supervisor's eyes flicked to the dog's teeth, and then away. Fear made people reach for force. Force would make Ranger fight. "They won't," Lila said quietly. Ro bristled. "Excuse me. They won't handle it safely," Lila said, still calm. "If you want him out without someone getting hurt, let me move the chair." Ro's jaw worked. The woman with the tablet stared at Lila as if she were watching someone step off a ledge. Creed leaned closer to Ro, whispering something urgent. "Liability," Lila thought without hearing the words. Ro's eyes hardened. "Fine," he said. "Get them out now." Lila pushed the wheelchair toward the front entrance. The hallway opened into the waiting area again, and people turned to stare as if they were watching a scene in a movie they did not pay for. Ranger walked tight to the chair, favoring the injured leg but keeping his head up. His eyes tracked strangers with disciplined suspicion. He did not bark. He did not lunge. He simply moved like a trained weapon held on safe one breath away from being switched back on. A nurse near the vending machines looked at Lila with something like disbelief. "You're really fired," she whispered. Lila did not answer. She kept moving. Elias's hands trembled on the armrests. His throat worked. "This is my fault," he murmured. "No," Lila said. "It's not." "But you," he began. Lila cut him off gently. "Don't," she said. "You needed help. That's the whole story." At the front doors, security hovered, keeping distance now as if Ranger's calm made him more frightening. Calm meant control. Control meant the dog could choose. The automatic doors hissed open. Rain sound rushed in clean and sharp, washing the stale ER air away. The night outside was cool and dark, the ambulance bay lit by harsh white lights that made the wet pavement gleam like metal. Lila pushed Elias through the doorway. Ranger stepped with them, paws clicking on tile, then on concrete, the injured leg still careful. Outside, the air felt heavier damp with ocean salt and storm water. The hospital behind them pulsed with noise through the glass, but the covered entrance was quieter. A small pocket of space where nobody shouted commands. Lila stopped just under the awning, hands still on the wheelchair handles. Elias looked up at her eyes, searching her face. "What now?" he asked. Lila swallowed. She did not have a plan. She had only a next step. "I can call a 24-hour clinic," she said. "Or the base medical line if you have one. We can get him imaging." Elias nodded slowly. "I can make a call," he said. Ranger stood close, head lowered, breath, steady eyes still scanning the darkness beyond the parking lot. The elastic wrap was visible beneath the fur, slightly damp. The limp remained, but the dog no longer looked like he might explode. Lila released one hand from the wheelchair and let it rest briefly on Ranger's shoulder again. A final reassurance. "You're doing good," she murmured. Ranger leaned into her palm just once. Behind the glass, Director Ro stood with Creed and two security supervisors watching like men who wanted the problem to stay outside. The fluorescent lights painted their faces pale and distant. Lila turned her head and met Ro's gaze through the doors. She did not glare. She did not plead. She simply held his eyes for a heartbeat, then looked away. The night air hit her lungs, and she realized how long she had been breathing the ER's recycled fear. Elias cleared his throat. "I never got your name," he said. "Lila," she replied. He nodded once, as if filing it away somewhere that mattered. "Lila," he repeated, and the way he said it carried weight, like he was trying to give her something he could not afford to lose. Ranger shifted his stance, careful with the injured leg, and kept his body between Elias and the open driveway. His ears rotated toward distant sounds, reading the world beyond the lights. Lila tightened her grip on the wheelchair handles again, more from habit than need, and guided Elias a few feet farther from the doors so they would not be forced back inside. Rainwater dripped from the awning in steady lines. The pavement gleamed. The hospital's entrance lights reflected in dark pools, turning the concrete into a fractured mirror. Lila stood beside the wheelchair-fired badge, still clipped to her scrubs, and felt the quiet settle around them like a held breath. The held breath did not last. A vibration climbed through the concrete, subtle at first, like a distant thunder you felt more than heard. Lila tightened her grip on the wheelchair handles as the tremor sharpened into something mechanical, controlled and heavy. Ranger's head lifted fast. His ears rotated forward not in fear, but in instant recognition. The dog went still in a way that did not belong to an animal guessing. Elias narrowed his eyes toward the empty driveway. "You hear that?" he asked. Leela did not answer. The sound was too precise, too coordinated. It was not a delivery truck and it was not an ambulance. It was a convoy. Headlights swept across the rain-slick pavement in hard white bands, cutting the darkness into clean, geometric shapes. One vehicle rolled into view, then a second, then two more behind it, all. Black SUVs identical down to the tinted windows and the spacing between them. They moved like they were following a plan that had been rehearsed. The lead, SUV, stopped at the edge of the covered entrance. The others fanned out in a shallow arc that left a wide lane open to the doors, not blocking the ambulance bay, not causing chaos, just taking possession of the space with quiet certainty. Engines idled low, a deep controlled growl that made the glass doors tremble. Inside the hospital, behind the doors, security had already gathered. Lila saw them through the reflection. They stood straighter now, hands near radios, eyes wide with that look people get when they realize the rules they rely on might not apply. Director Keenan Rowe pushed through the automatic doors with Dr. Malcolm Creed at his shoulder. Rowe's face was tight with irritation, but his eyes flicked to the convoy and changed. The irritation did not vanish. It rearranged itself into caution. Ranger shifted closer to Lila's leg and held position body angled between Elias and the driveway. He did not bark. He anchored. The dog was telling her without words that the people stepping out were not strangers. The lead SUV's door opened. A man emerged who made the night feel smaller without raising his voice. Tall, broad-shouldered, wearing civilian clothes that still sat on him like a uniform. His hair was cropped short silver at the temples. He scanned the entrance with methodical precision, eyes moving to the corners, the glass, the people behind it. He was not looking for a threat. He was mapping responsibility. Behind him, other doors opened in sequence. 3 more men stepped out, then 2 from the second SUV, then 2 from the third. No exposed weapons, no shouting, but every one of them moved with the same controlled economy as if noise was optional and mistakes were expensive. Rowe stepped forward into the rain edge under the awning and forced a smile that did not reach his eyes. "Good evening," he said. "This is a civilian hospital. Can I help you?" The lead man did not answer Rowe's greeting. His gaze moved past Rowe as if Rowe were a signpost. "The nurse," he said. Calm, even, not asking. "Where is she?" Rowe blinked rapidly. "I'm sorry," Rowe said. "Which nurse?" "The one who touched the dog," the man replied. At the mention of the dog, Ranger sat perfectly. No command, given no hesitation. Just the kind of obedience that belonged to training deeper than instinct. Elias's posture shifted too. His shoulders drew back, spine straightening against the wheelchair as if old muscle memory had resurfaced. He did not smile. He nodded once, barely visible. The man returned the nod with something more than courtesy. Respect. Hard-earned and absolute. Rowe's forced smile cracked at the edges. "Sir," he said, "I need to know who you are and why you are here. Our staff has procedures." The man's gaze snapped back to Rowe, focused now, and the temperature under the awning seemed to drop. "Where is the nurse?" he said again, voice still quiet but carrying the weight of someone who did not repeat himself often. Rowe swallowed and tried to reclaim authority by leaning on the only thing he trusted. "She broke protocol," he managed. "She is no longer employed here." The man did not react the way Rowe expected. No surprise, no confusion. Just a small narrowing of the eyes, as if he was confirming something he already knew. "Has she?" he said. Lila stepped forward. "I'm here," she said, one hand still resting on the wheelchair handle, the other hovering close to Ranger's harness out of habit. The men behind the lead figure shifted their stance slightly, not threatening, but subtly repositioning so the entrance and the driveway were covered. It was not dramatic, it was just competence. The lead man turned. For a fraction of a second, something flickered across his expression. Recognition, not anger. Not relief either. Something more complicated, like a memory that had weight. "Leela," he said, quieter now. Lila's jaw tightened, then smoothed. "Sir," she replied. Roe's eyes darted between them. "You two know each other," he said, trying to sound in control. The lead man ignored him. He crouched just enough to look at Ranger properly. Palm down, fingers relaxed. Ranger leaned forward to sniff deliberate, then pressed his forehead against the man's knuckles in a firm, familiar gesture. A murmur rippled through the staff behind the glass. Even Creed looked unsettled now, as if his neat categories had just been knocked off the shelf. The man straightened and looked at Lila again. "You made contact," he said. "Yes, sir." "And he permitted it." "Yes, sir." The man nodded once, like he was checking boxes on a list in his mind. "Your assessment," he said. Leela did not hesitate. "Soft tissue injury," she replied. "Likely ligament strain in the left hind. He needs imaging to rule out anything worse: stabilization, anti-inflammatory medication, and restricted movement." The man's eyes sharpened slightly. "You are certain?" Lila held his gaze. "As certain as I can be without imaging," she said. He studied her for a moment longer, then gave a faint nod that looked like approval. Roe found his voice again thin and strained. "Sir," he said with respect, "this remains a hospital administrative matter. Regardless of who you are, a civilian facility has regulations." The man finally looked at Roe in a way that made Roe's words feel small. "Rear Admiral Grant Mercer," he said evenly, "United States Navy." Silence hit like a wall. Roe's mouth opened, closed, opened again. "Admiral," he stammered. "I had no idea." "You were not supposed to," Mercer replied. Mercer gestured subtly toward Elias. "Do you know who that man is?" he asked. Roe glanced at Elias, then back at Mercer. "A patient," Roe said, uncertain now, as if the word might offend. Elias released a dry laugh. Naturally, Mercer's voice stayed calm, but steel reinforced every syllable. "That man commanded a task element during Gulf operations," Mercer said. "He lost the use of his legs extracting 2 of my operators from a collapsing structure while under fire." Roe's face drained of color. Mercer's gaze moved to Ranger. "And the dog your facility refused to help," he continued, "is a military working dog under active status. Documented deployments, documented commendations, government property with a handler who does not abandon him." Roe's eyes flicked to Ranger and then away, like looking at the dog too long might make the truth worse. "I wasn't informed," he said weakly. Mercer's expression hardened. "Precisely the issue," he replied. Creed stepped forward, clearing his throat as if he could turn this back into a policy debate. "Admiral," he said, "our staff did not refuse care to the veteran. The animal was the problem. We are not a veterinary clinic. We have liability." Mercer's eyes landed on Creed. It was the first time the doctor looked truly uncomfortable. "You are a physician," Mercer said. "Yes, sir," Creed replied quickly. Mercer nodded once. "Then you understand that pain turns discipline into a knife edge," he said. "You saw a working dog holding the line while injured and decided the threat was the dog, not your own inaction." Creed's jaw flexed. "With respect, sir," he said, "the nurse acted without authorization. She placed staff at risk." Mercer took one step closer to Creed. He did not loom. He did not raise his voice. He simply reduced the space until Creed had to lift his chin to maintain eye contact. "You had alternatives," Mercer said quietly. "You chose bureaucracy over judgment." Roe tried again to find ground. "Admiral," he said, "if there has been a misunderstanding, we can correct it. We can reinstate her employment. But the protocol exists for a reason." Mercer turned his attention back to Lila. "Why did you intervene?" he asked. Leela did not pause. "Because he needed help," she said. She glanced briefly at Ranger, then back at Mercer. "That is all." Mercer studied her face. "You did not identify the veteran," he observed. "No, sir." "You did not identify the dog." "No, sir." "You accepted termination without argument." Lila's mouth moved slightly, not quite a smile. "It would not be the first time," she said. Roe's eyes narrowed at the exchange, as if he could feel a door in the room that did not belong to him. Mercer exhaled slowly through his nose, then turned to Roe with the decision already made. "We are past discussion," Mercer said. "Here's what will happen." Rowe's spine straightened reflexively. "Yes, Admiral," he said, voice strained. Mercer's gaze flicked toward the hospital interior. "The K-9 receives appropriate treatment immediately," he said. "Imaging, medication, stabilization, whatever is required. You will coordinate with naval veterinary and medical assets if needed. You will not delay because the paperwork makes you nervous." Rowe nodded fast. "Yes, sir." Mercer's eyes narrowed. "I want a comprehensive report on why staff initially refused to provide even interim aid," he continued. "I want names, decisions, timestamps, and policy references. I want to know exactly where judgment failed." Rowe's swallow was visible. "Yes, sir." Mercer's attention shifted to Lila, and this nurse, he said, indicating her with a slight nod, will be left alone. A beat passed. Mercer corrected himself without changing tone. "No," he said. "She will be treated with respect. Any harassment, any administrative retaliation, any attempt to make her the scapegoat for your discomfort will be addressed through channels that do not end with your hospital keeping its current leadership." The words were not a threat delivered with anger. They were a fact delivered with clarity. Rowe's face tightened. "Understood," he said. Ranger's ears twitched at Mercer's voice, but he remained seated steady, as if he recognized command even in civilian clothing. Elias cleared his throat voice quiet. "Admiral," he said. Mercer turned to him immediately, the steel softening into something more human. "Chief," Mercer replied. The word landed with familiarity, and Rowe's confusion deepened. Elias shook his head slightly as if he did not want ceremony. "He needs care," Elias said, nodding to Ranger. "That's all." Mercer nodded once. "He will get it," he replied. Mercer turned to the men behind him and spoke without raising his voice. "Perimeter," he said. They moved as one, stepping into positions that looked casual to anyone unfamiliar with it, but formed a quiet grid around the entrance. One took the edge near the ambulance bay, eyes scanning vehicles. Another stood near the corner of the awning, watching the hospital doors and the parking lot beyond. A third remained close enough to Mercer to be seen and not close enough to crowd. Security guards inside the glass shifted, suddenly aware that their radios and batons were not the loudest authority in the space. Rowe gestured toward the doors with a tight hand. "Let's bring them back inside," he said, voice careful now. "For the dog's imaging." Creed's eyes flicked to Ranger. "It is still an animal," he muttered under his breath, more to himself than anyone else. Mercer heard him anyway. "It is a working dog," Mercer replied, still calm. "And it is injured. Treat the injury and stop talking as if compassion is a contagion." Rowe pushed the doors open with his shoulder stepping aside as if making way for a parade he never wanted to host. Lila tightened her grip on the wheelchair handles and guided Elias forward. The moment they crossed the threshold back into fluorescent light, the ER seemed to hold itself differently. People who had been whispering fell silent. A nurse near triage froze with a chart in her hands. Someone's phone disappeared quickly behind a sleeve. Ranger stood and moved with the chair, limping but controlled. The elastic wrap was still in place, slightly damp from the rain. Monica appeared from the corridor, eyes wide. "Lila," she whispered. Lila did not answer. She kept moving because stopping would let the room turn her into a spectacle. Rowe spoke fast to staff his tone, trying to sound like leadership instead of panic. "Clear trauma." "2," he said. "Now, get imaging ready. Call radiology. We need a room." A tech moved quickly, pushing a gurney out of the way. A nurse grabbed a clipboard. The department shifted from chaotic flow into coordinated urgency. Not because the dog had become more important than the other patients, but because the stakes had changed. Accountability had entered the building. Creed followed, face stiff. "We are not equipped for this," he said to Rowe. Rowe did not look at him. "We are equipped to do our jobs," Rowe replied, voice tight. "Move." Lila guided Elias into trauma 2. The room smelled like sterile plastic and iodine. A heart monitor sat silent until someone snapped leads into place. A blood pressure cuff lay coiled like a snake on the bed. Elias remained in his wheelchair. He refused the bed with a shake of his head. "I'm fine," he said. A nurse tried to argue automatically. "Sir, we need to evaluate you too," she said. Elias's eyes flicked to her and softened just enough to show he understood her duty. "Vitals," he agreed. "That's it." Leela moved Ranger into a position near the wall where he could see the door and Elias at the same time. The dog sat again, posture rigid, but calm eyes tracking every movement. He was still guarding, but the guarding was controlled now, redirected into discipline. A radiology tech appeared at the door and froze at the sight of the German shepherd. "We need him in imaging," the tech said, voice thin. Monica stepped in beside the tech. "He's stable," she said. "We'll move slow." Creed entered the room with Rowe behind him, both men trying to look like they had chosen this outcome. Rowe pointed toward the chair. "Mr. Harlan," he said, tone smoother now. "We apologize for the confusion. We will ensure proper care is provided." Elias looked at him and did not answer. Rowe's gaze shifted to Lila. "Nurse Bennett," he said, as if the name could erase the fact he had fired her 30 minutes ago. "You can assist under supervision." Leela met his eyes. "I am not employed here," she said quietly. Rowe's expression tightened. "Admiral Mercer requested respect," he said, choosing his words like he was stepping around broken glass. "This is how we show it. We are asking you to assist." Creed's mouth tightened. He looked like he wanted to object and understood he could not. Lila did not answer Rowe immediately. She looked at Ranger. The dog's eyes held hers steady, measuring. Lila turned back to Rowe. "I will assist for the dog's safety," she said. "Not for your administration." Rowe's jaw flexed. "Fine," he said. Mercer appeared in the doorway, filling it without blocking it. One of his men stood behind him, watching the hall. Mercer's eyes moved across the room, checking Ranger's posture, Elias's breathing, the staff positions. He looked at Lila. "You will stay with him during imaging," Mercer said. Not a request. Not a burden. A decision based on the simplest reality. Ranger trusted her. Creed bristled. "That is not standard," he said. Mercer's gaze shifted to Creed. "Then adjust your standard," he replied. "Or step aside for someone who can." Creed's face flushed slightly. "I am responsible for this department," he said. Mercer held his gaze. "Then be responsible," he said. Monica stepped closer to Lila and lowered her voice. "Can you walk him?" she asked. Eyes flicking to Ranger, to imaging. Lila nodded. "Slow," she said. "No one crowds. No one reaches for his harness unless I tell them." Monica nodded, quickly, relieved to be given clear instructions. Lila placed one hand on Ranger's shoulder, the other near the harness handle, but not gripping it. She looked at Elias. "Do you want to come?" she asked. Elias's eyes tightened. "I'm not leaving him," he said. Leela nodded once. "We'll bring your chair," she replied. A tech moved to help push the wheelchair. Elias's voice cut through, controlled. "I'll roll myself," he said. The tech stepped back. They moved into the corridor as a unit. Lila walking on Ranger's right side, close enough to reassure him, but not crowding. Elias rolling behind, leash in hand. Monica trailing on the other side, ready to intervene if the dog startled. The hallway seemed to widen and narrow depending on who stepped into it. Nurses pressed themselves to the wall. Residents stopped mid-step and waited. A patient on a gurney stared eyes wide as Ranger passed with quiet authority. Ranger's limp was still visible, but his head stayed level, eyes sharp, breath steady. In the imaging bay, the techs were tense. They moved with the careful stiffness of people who had never been taught how to handle a working dog in pain. Lila saw their fear and understood it. Fear made people act strange. She spoke in a low, even tone that kept the room from turning into a mess. "He stays with his handler," she said. "I stay with him. Nobody touches his face. Nobody comes from behind." A tech nodded quickly. "Yes, ma'am." Lila guided Ranger onto the table with quiet pressure, a hand under his chest, a hand near his harness. Ranger's paws hesitated at the metal surface. He glanced back at Elias. Elias leaned forward slightly and spoke in the same voice he used when he wanted the dog to hold under fire. "Up," he said. "Good, stay." Ranger climbed onto the table, careful with the injured leg, and held still. Lila placed her palm on his shoulder and breathed slowly, letting Ranger match her rhythm. The dog's eyes flicked to her face once, then forward again. The imaging tech slid equipment into place, hands shaking slightly. Lila kept her own movements minimal, a stable point in the room. Still, she whispered to Ranger. Ranger held still. The machine hummed. The room quieted into the controlled silence of focused work. Outside the imaging bay, Roe hovered with Creed and a legal-looking administrator. Roe's voice was low but urgent. "This is going to be a nightmare," he murmured. Creed's voice came back sharper. "It never should have gotten this far," he said. "We do not treat dogs." Roe's eyes flicked toward Mercer, who stood down the hall with his men, posture relaxed, but attention wide. "We treat consequences," Roe replied. Apparently. Mercer looked at them both as if he heard every word. He did not correct them. He did not need to. The correction was already happening. When imaging finished, Lila guided Ranger off the table with the same careful steadiness. The dog's injured leg shook slightly when he stepped down. He clenched his jaw, refusing to show pain beyond the tremor. Lila's chest tightened. She had seen that kind of restraint in people, too. It always ended in worse injury if you ignored it. She knelt briefly and checked the wrap again, fingers moving along the joint with gentle pressure. Ranger's breathing hitched once, then steadied. "Okay," she murmured. "Okay." Elias watched her eyes, heavy with emotion he refused to wear openly. "You didn't ask," he said quietly. Lila looked up. "Ask what?" she replied. "Who I was," he said. Lila shook her head. "It didn't matter," she answered. "You needed help." Elias's mouth twitched, not quite a smile. "That used to be enough," he said. Lila did not answer. She rose and guided Ranger back toward Trauma 2. As they walked the hall again, the ER felt different. Not calmer exactly, but tighter, like a room holding itself to a higher standard. Staff moved faster. Conversations dropped into whispers. People avoided Roe's eyes. Creed walked with his jaw clenched as if every step was a concession. In Trauma 2, a nurse prepared medication. A physician from orthopedics appeared summoned quickly, eyes darting between Ranger and the chart as if he could not decide which one was real. Monica handed the physician the imaging summary. The physician cleared his throat. "It looks like soft tissue strain," he said, voice cautious. "Possibly partial ligament involvement. No fracture." Lila kept her hand resting on Ranger's shoulder. The dog's ears twitched at the unfamiliar voice. Monica nodded. "We can give anti-inflammatory medication," she said, "and recommend rest. Splinting may help temporarily." The physician glanced at Lila. "She handled him better than any of us," he admitted, quiet. Creed bristled at the implication. "This is still not our scope," he muttered. Mercer entered the room again, hearing enough. "Scope does not excuse neglect," he said. Roe stood behind Mercer now, face-pale tie, crooked sweat visible at his hairline. "Admiral Roe said we are complying fully." Mercer's eyes moved to Lila. "How is he asked. Lila answered with the same direct professionalism she had used in the waiting room. "He's calmer," she said. "The wrap is holding. He needs controlled rest and medication. He should not be walking. He needs a safe transport plan." Mercer nodded once. "Transport will be arranged," he said. Elias raised his chin slightly. "I will go with him," he said, voice firm. Mercer's eyes softened. "You will," Mercer replied. Roe tried once more to salvage something. "Nurse Bennett, he said we can reverse the termination." Lila turned her head slowly. "You fired me for preventing a bite," she said, "and for treating pain." Roe's mouth tightened. "You acted without authorization," he said, clinging to the phrase because it was the only thing that made him feel less wrong. Lila's voice stayed even. "I acted with judgment," she replied. Roe looked toward Mercer as if expecting rescue. Mercer did not give him one. He gave him reality. "She will not be used as your shield," Mercer said. "Your protocols are yours to manage. Your consequences are yours to own." Roe's face flushed. "We were trying to protect the hospital," he said, voice cracking slightly. Mercer's gaze sharpened. "Protect it from what?" he asked. "From doing the right thing in public." Roe's lips parted, but nothing came out. Mercer turned away from him and looked at Lila again. "Are you all right?" he asked. Lila met his eyes. "Yes, sir," she said. "You certain?" Mercer asked. Lila's expression did not change. "Always," she replied. Mercer nodded once, then looked toward his men. "Maintain," he said quietly. They shifted positions in the doorway and hall without fuss, holding space, ensuring nobody crowded Ranger, ensuring nobody cornered Lila. Inside the trauma room, a nurse approached Ranger with a syringe, hands careful. Lila placed her palm on Ranger's neck and spoke low. "Easy," she said. "A pinch, then done." Ranger's eyes flicked to her and held. He did not flinch when the needle went in. His jaw tightened slightly, then loosened. Discipline. Trust. The nurse exhaled as if she had been holding her breath for minutes. "Good boy," she whispered before she could stop herself. Ranger did not react to the praise. He reacted to Lila's hand grounding steady. Elias watched the whole thing with a weary reverence, as if seeing a bond that had kept him alive in places most people could not imagine. Roe stood near the door, looking smaller than he had in the corridor when he fired her. Not physically. In the way his authority now required permission from forces he could not threaten with termination. Monica approached Lila quietly when the medication was done. "You should sit," Monica murmured. "You're shaking." Lila looked down at her hands. They were steady. Then, as if her body heard the words and decided it could stop pretending, a faint tremor crept into her fingers. Lila closed her hands into fists once, then relaxed them. "I'm fine," she said. Monica's eyes held hers. "You're not?" Monica replied soft. Lila did not argue. She simply shifted her stance and kept her palm on Ranger's shoulder because grounding him grounded her too. A stretcher team arrived with a transport plan. Mercer spoke quietly with hospital staff and a naval medical contact on a phone that he held low enough that nobody could hear. Roe hovered, listening to every word he could catch. Creed stepped closer to Roe and hissed, "This is going to be on every channel by morning." Roe's eyes flicked toward the hall. "Then we will look competent," he whispered back. "For once." Creed's mouth tightened, but he said nothing more. In the trauma room, Ranger shifted slightly and tested his injured leg, then stopped, obeying the discomfort. Lila watched the movement and adjusted the wrap, gentle, efficient. Elias's eyes grew glossy again. He looked away quickly, refusing to let anyone see it. "You never asked," he repeated, voice quieter now. Lila kept her focus on Ranger. "I didn't need to," she said. Elias swallowed hard. "It used to be enough," he said again, almost to himself. Lila finished adjusting the wrap and rose. The room had turned into a different kind of quiet. Not fear, not chaos, something closer to gravity. Staff moved with care. Voices dropped. People made room without being told. Mercer stepped closer to Lila, voice low enough that only she could hear. "You disappeared too well," he said. Lila kept her eyes forward. "That was intentional," she replied. Mercer's mouth twitched slightly, not quite a smile. "I know," he said. Roe noticed the exchange and stiffened, but he did not interrupt. A transport order was finalized. A naval vehicle would take Ranger and Elias to a facility equipped for military working dog follow-up. The hospital would provide interim stabilization and documentation. Mercer turned to Roe one last time. "You will have that report on my desk," Mercer said. "Yes, sir," Roe replied quickly. Mercer's gaze held him. "And you will revise your protocol," he added. "Not to treat animals broadly, to handle working partners with basic interim care and proper referral without panic. You will train your staff. If your people are afraid, teach them. Fear is not policy." Roe nodded, face tight. "Yes, Admiral," he said. Mercer's attention returned to Lila. "You are done for tonight," he said. Lila blinked once. "I'm not employed," she reminded him. Mercer's tone stayed even. "You are done," he repeated. "Go wash your hands. Breathe. Then decide what you will do next, not what they decide for you." Lila held his gaze for a heartbeat. Then she nodded. "Yes, sir," she said. Elias looked up at her. "Thank you," he said again. Lila's throat tightened. She kept her voice steady. "Get him healed," she replied. "That's what matters." Ranger's eyes followed her as she stepped away, steady and alert, but calmer now, the edge of pain blunted by care. Lila walked out of Trauma 2 and into the corridor where the fluorescent lights buzzed and the smell of antiseptic returned full force. She passed a nurse station where people pretended not to stare, and a supply cart where someone had left gauze scattered like snow. At the sink near Trauma 1, she turned the water on and let it run longer than necessary. The sound filled her ears, smoothing the sharp edges of the night. She rubbed soap into her palms. Her fingers trembled slightly as the water hit them. The blood that swirled briefly down the drain was not hers. It belonged to the work that never stopped. Still, she watched it disappear as if it meant something she could not name. Behind her, the ER continued moving. Phones rang. Monitors chirped. Nurses called out medication doses. Somewhere down the hall, Ranger's nails clicked on tile as he was guided toward transport, his limp softened by support, his posture still proud. Lila kept washing until the tremor in her hands quieted enough to hide. She shut the water off slowly and stared at her reflection in the stainless steel fixture, face pale under harsh light eyes, clear jaw set. The room around her felt full of eyes, even when she could not see them. Then, without any sound of footsteps close enough to justify it, she felt a presence behind her shift the air. The presence behind her did not announce itself with footsteps. It settled into the space the way pressure settles before a storm. Lila kept her hands under the running water, fingers spread, watching soap slide off her knuckles in thin white ribbons. Her shoulders stayed square. Her breathing stayed quiet. She did not turn fast because fast was a language that invited force. You always did that, a voice said behind her. Stayed quiet when everyone else panicked. Lila shut the water off slowly. The sink went from roar to drip, and the silence that followed felt sharpened. She turned. Rear Admiral Grant Mercer stood a few feet back, hands clasped behind him. Civilian jacket darkened by rain at the shoulders. Under fluorescent light, the lines at the corners of his eyes looked deeper earned. He held his posture the way some men held a weapon, safely, deliberately, never carelessly. "You are supposed to be outside," Lila said. Mercer tilted his head slightly. "So are you." Lila reached for a paper towel and dried her hands with more patience than she felt. "I was removed," she said, "officially." Mercer watched her without blinking. Rowe thinks paperwork is gravity. He thinks it forces the world to obey. Lila dropped the towel in the bin. He thinks he is protecting his hospital. Mercer's mouth tightened. He's protecting his comfort. Lila did not answer. She could still feel Ranger's heat in her palm, the way the dog had leaned into her touch like he had been holding himself up on discipline alone. She could still hear Elias's voice, controlled and tired, telling everyone what not to do to keep them safe from their own fear. Mercer's gaze moved over her badge, the clip still attached to her scrub pocket like an accusation. "You took the hit clean," he said. "I did what I had to," Lila replied. "That is the problem," Mercer said. His voice stayed quiet, but there was a hard edge under it. "You always do what you have to, and then you disappear before anyone can argue." Lila's jaw flexed once. That was intentional. "I know," Mercer said. A beat passed where neither of them moved. Around them, the ER hummed busy again. A call light chimed twice. A nurse's shoes squeaked on tile as she hurried past the end of the corridor. Somewhere down the hall, a patient moaned in pain, low and steady, as if they had learned there was no point in making it loud. Mercer stepped closer, lowering his voice further. "You should not have been here tonight." Lila held his gaze. "Neither should you." Mercer did not deny it. He looked past her toward the corridor where Rowe and Creed had been hovering like men, trying to control a flood with sandbags. "I heard you left," Mercer said. "No goodbye, no explanation." Lila's eyes remained calm. "You would have argued." "I would have helped," Mercer replied. Lila's mouth moved slightly, almost a smile, but it carried no warmth. "Help is not always safe." Mercer's eyes sharpened. "You left because you thought you were a risk." Lila did not answer. The silence was not empty. It was loaded the way a locked door was loaded. Then the hallway changed. It was subtle at first. A shift in the sound, as if the department had inhaled. Voices softened. A few heads turned toward the glass doors at the far end of the corridor. A nurse at the station stopped mid-sentence, her mouth still open, eyes fixed. Mercer's posture adjusted, not alarmed, ready. Lila felt it too, the same instinct that had made her step out from behind the medication cart. The air had acquired new edges. 2 men in dark suits walked through the main entrance. They did not carry themselves like doctors or administrators. They did not move like police either. Their pace was measured. Their eyes were busy. One scanned corners, exits, sight lines. The other held a thin folder and a badge that flashed too fast for anyone to read. They stopped at the nurse's station. The nurse behind it swallowed hard. "We are looking for Nurse Lila Bennett," the first man said, voice polite and flat. The nurse glanced down the hall as if hoping someone else would answer. Mercer moved before the nurse could speak. He stepped into the corridor between the agents and the station, calm and immediate. "She is not available," Mercer said. The first agent's gaze flicked to Mercer's face, registering rank without being told. He did not look intimidated. He looked like someone who worked in rooms where rank was data, not a shield. "With respect, Admiral," the agent replied, "she is available to us." Mercer's voice stayed even. "Who are you?" The agent held the badge a fraction longer this time. Still too fast for the staff watching, but long enough for Mercer. "I am Special Agent Daniel Price," he said. "Naval Criminal Investigative Service." The second man remained near the door, arms folded loosely, eyes still scanning. Mercer did not move aside. "This is a civilian hospital," he said. "You do not walk in and start pulling staff out of hallways." Price's expression did not change. "We are not here for the hospital," he said. "We are here for the event." Lila stepped forward then. Not abruptly. Just enough that the choice belonged to her. "I am Lila Bennett," she said. The second agent's eyes locked onto her immediately. His gaze was unnervingly precise, like a laser settling on a point. Price looked at her and offered a smile that did not soften his face. "Nurse Bennett, we would like a word." Mercer's attention flicked to Lila, a silent warning. "You do not have to." Lila gave him a small shake of her head. It was not bravery, it was calculation. The kind that kept people alive. "I will talk," she said. Price nodded once. "Thank you." Mercer stepped closer to Lila, voice low. "Do not volunteer," he said. "Answer what is asked, and nothing else." Lila met his eyes. "I know," she replied. Price gestured toward an empty consultation room off the corridor. "In here." They walked with the measured pace of people who understood that panic made mistakes. The second agent took position near the door as they entered, shoulders angled to keep the hallway in view. Price sat across from Lila at a small table, placing his folder down with careful neatness. The room smelled faintly of stale coffee and cheap sanitizer. A single fluorescent light hummed overhead slightly louder than it should have been. Lila remained standing for a beat, then sat, hands folded on the table. She kept her shoulders relaxed, her eyes steady. Price opened the folder but did not look down yet. He watched her as if reading micro-movements. "You did not identify the veteran," he said. Lila blinked once. "No." "You did not identify the K-9," Price continued. "No," Lila replied. "You did not identify yourself," Price said. Lila held his gaze. "I was working triage." Price's smile twitched slightly. "You were working triage when you were off duty." Lila did not answer. The second agent shifted near the doorway, transferring from one foot to the other. He did not look impatient. He looked as if he had done this 1,000 times and had learned that pressure was applied best through silence. Price leaned back in his chair and folded his hands. "You handled the animal like a military handler," he said. Lila's tone stayed flat. "I handled him like a patient." Price tilted his head. "Your word choice is interesting." Lila did not react. Price continued, voice smooth. "You used a calming sequence not taught in civilian nursing programs. Not warrants-based training, not veterinary handling courses." Lila's eyes remained still. "I spoke softly," she said. Price smiled again, colder. "You did more than speak softly." He slid a tablet across the table. On the screen was security footage from triage. Grainy zoomed in. Lila's body angled, hands open, the slow approach. Ranger's mouth, open teeth visible, then the sudden shift as he leaned into her touch. The video had no sound, but Lila could remember it anyway. The moment the dog chose to stop fighting. Price tapped the screen once. "You did not hesitate," he said. Lila pushed the tablet back slightly, not aggressive, just refusing to accept its frame. "He was hurt," she replied. Price's eyes narrowed a fraction. "That is what concerns us." Lila's lips pressed together. Concerned is an odd word for someone who arrived after he was stabilized. Price did not react. He opened the folder and finally looked down. "You were declared inactive 8 years ago," he said. The air in the room tightened, not because Lila moved, but because the words landed too close to something she kept buried. Her pulse thudded once heavy. Price lifted his eyes. Classified medical designation. No discharge record. No separation documentation. No official transfer. Lila's voice stayed calm. "I left," she said. Price nodded slowly, like he had expected that answer and found it insufficient. "You disappeared," he replied. Lila met his gaze. "People disappear all the time." Price's smile returned thin. "Not from that unit." The second agent spoke for the first time, voice quiet and blunt. "That unit does not lose people. It erases them." Lila leaned back slightly in her chair. She crossed her arms, posture casual enough to be believable, controlled enough to hide the tension. "Then you have your answer," she said. Price's eyes sharpened. "You are not denying it." Lila's tone remained even. "You did not ask me a question," she replied. Price let a bead of silence sit on the table. The fluorescent light buzzed. Somewhere outside the room, a call light chimed twice, then stopped. Price closed the folder gently. "Tonight he said you broke hospital protocol." "Yes," Lila replied. "You treated government property without authorization," Price said. Lila held his gaze. "He is not property," she said. Price's expression did not change. "He is a military working dog." Lila's eyes remained steady. "He was limping," she replied. "He was in pain." Price's voice stayed polite. "And you revealed capability." Lila's jaw tightened. "I revealed nothing." Price's eyes flicked to the tablet again. "You revealed yourself," he said. The second agent shifted near the door, his gaze moving briefly to Lila's hands, then back to her face. Price leaned forward slightly, lowering his voice. "We are not here to arrest you," he said. Lila's expression stayed flat, yet she replied. Price's smile was almost appreciative. Yet he agreed. Lila exhaled slowly through her nose. "You are late," she said. 8 years by your count." Price nodded as if acknowledging a point in a debate. "We are here to assess risk," he replied. Lila's lips curved into something that was not humor. "Risk," she repeated. From a nurse in a civilian ER. Price did not take the bait. From someone trained to remain unseen, he said, "Someone who still uses techniques that do not appear in any civilian curriculum." Lila's gaze hardened. "I used calm," she said. "If you want to classify that, you should start with every good nurse in this building." Price held her eyes. "We are not talking about calm," he said. "We are talking about trained calm." The words sat between them, sharp and specific. Outside the door, Mercer's voice came faintly through the wall, muffled but firm. "Careful." Price did not turn toward the door. He simply continued. "You touched the dog without hesitation," he said. The dog responded as if you spoke a language he already knew. Lila's voice stayed low. "He responded because I did not threaten him." Price's smile faded. "He responded because you did something familiar." Lila did not answer. Price stood and gathered the tablet, sliding it back into his folder. "This is not a criminal interview," he said. "This is an assessment. If we decide you are a liability, this will change." Lila's eyes stayed on him. "Decide faster," she said. "I have patience." Price paused at the door hand on the knob. His voice softened, not kinder, just quieter. "You can keep pretending you are invisible," he said. "But tonight you were seen." Lila's expression did not shift. "Then stop staring," she replied. The second agent opened the door, first stepping into the corridor and scanning before Price followed. They moved out with the same controlled pace they arrived with. No threats spoken aloud, no promises made, just presence, leaving behind the sensation that the walls had ears. Lila remained seated for a moment after they left. She unclasped her hands and flexed her fingers once under the table, then stilled them again. She listened to the hospital's rhythm beyond the consultation room, the steady pulse of an ER that did not care about classified histories. She rose and walked out. Mercer stood in the hallway, arms relaxed at his sides, but his eyes were sharp. His men were farther down the corridor, positioned with quiet competence. Staff moved around them like water around rocks. "You okay?" Mercer asked. Lila nodded once. "They will keep watching," she said. Mercer's mouth tightened. "I know," he replied. Monica approached from the imaging area, breathless, eyes wide with adrenaline. "He is walking better," she said, voice quick and earnest. "The medication is helping." Lila felt a weight lift from her chest that she had not realized she was carrying. She did not smile. She simply exhaled. "Good," she said. From the far end of the corridor, a commotion rippled. Not panic, noise. Multiple voices overlapping. A sound like a crowd trying to organize itself. Rowe hurried past with a phone pressed to his ear, face pale. "I did not know," he kept saying. "I did not know." Creed followed jaw-tight eyes darting toward the entrance. Mercer's gaze moved to the glass doors at the front of the department. Bright flashes burst beyond the glass, stuttering light across wet pavement. Lila stepped closer to the doors and looked out. News vans had arrived. Two, then more behind them, parked along the curb where visitors were not supposed to stop. Camera operators hurried under rain covers, lenses pointed at the entrance. Reporters clustered near the awning like they had scented blood in the water. A banner on the side of one van read in bold letters, "Civilian Hospital, Military Response." Rowe stopped near the entrance, sweating through his shirt collar, phone still in hand. A woman from administration appeared beside him, whispering urgently. Rowe nodded too fast, as if agreeing could reverse time. Lila watched the flashes and felt something cold settle in her gut. Not fear of cameras. Fear of attention. Mercer stepped up beside her. His voice was low. "They are going to make noise," he said. Lila kept her eyes on the glass. "Someone leaked it," she replied. Mercer's gaze shifted toward Rowe and Creed. "Someone always does," he said. Rowe approached, forcing a smile that looked like pain. "Nurse Bennett," he began. "We need to manage messaging. We need to be careful." Lila turned her head slowly. "Careful," she repeated. Rowe's smile faltered. "This is sensitive," he said. "There are optics, liability, public perception." Mercer's voice cut in calm and flat. "Ignorance is not a defense," he said. Rowe's face tightened. "Admiral, we are doing everything we can," he insisted. Mercer looked at him as if measuring a man by weight and finding the scale broken. "Do more," he said. A security guard opened the doors a crack to look out, then shut them again quickly as reporters surged toward the movement. A nurse near the station whispered, "They are asking about the dog." Another whispered back, "They are asking about the nurse." Lila's chest tightened. Mercer turned to one of his men and spoke quietly. The man nodded and moved toward the entrance, taking position just inside the doors, where he could be seen without being dramatic. His presence alone altered the way the reporters pressed forward. Rowe ran a hand over his face, trying to wipe away the night. "We can reinstate her," he said to Mercer quickly, words tumbling. "We can issue a statement. We can say it was a misunderstanding, a miscommunication. We can say the nurse acted bravely and the hospital responded appropriately." Lila stared at him. "You fired me," she said. Rowe's mouth opened, closed, opened again. "I enforced policy," he replied weakly. Lila's voice stayed quiet. You enforced fear, she said. Ro's eyes darted to the doors again as flashes continued outside. We cannot have this become a spectacle, he said. Mercer's gaze stayed on the glass. It already is, he replied. A staff physician hurried down the corridor with a clipboard, face flushed. They are asking questions, he muttered half to himself. Mercer watched him pass. Real questions, he said. Lila felt the pressure in the department change again, as people realized the story outside would not match the story inside. The hospital could not hide behind protocol when cameras were parked at its front door. Elias rolled into view near the entrance, escorted by a nurse and one of Mercer's men. His posture was straighter now, face clearer. Ranger walked beside him, bandage and wrap visible head level despite the limp. The dog's tail moved once restrained and then stilled. Discipline returned now that pain had been addressed. When Ranger reached Elias's side, he sat perfectly, eyes forward. A reporter outside caught the silhouette through the glass and raised a microphone toward it like the dog could answer. Elias looked toward Lila. Their eyes met through the hum of activity. He lifted a trembling hand and gave her a small salute, precise, despite age and exhaustion. Lila did not return it. She placed her palm gently on Ranger's head instead. The dog leaned into her touch once a quiet confirmation. Mercer watched the gesture with something like approval. Ro stepped forward, voice tight. We need to clear the entrance, he said. We need to secure this area. Mercer turned his head slightly. You need to stop trying to control the story, he said. Control your department. Ro swallowed hard. Outside, the doors opened. Reporters surged forward, microphones raised, questions thrown like stones. Admiral, why the response here? Is the dog okay? Who is the nurse? Did the hospital refuse to treat a veteran? Mercer stepped out under the awning with calm authority. He did not shout for silence. He stood until the noise thinned the way a room quieted when it recognizes command. This hospital did not fail tonight, Mercer said, voice even. It was reminded. A reporter pushed forward. Admiral, who was the nurse who treated the K-9? Mercer glanced back through the glass at Lila. Lila shook her head once small and firm. Mercer turned back to the cameras. She is exactly who she says she is, he replied. The reporters shouted again, louder, hungrier. The question they wanted was not her name. It was her story. Inside, Lila stepped back from the doors. She kept her face neutral. She did not want to be a headline. She did not want her hands turned into a symbol. Monica approached and touched Lila's arm briefly, then pulled back as if unsure she was allowed. Are you okay? Monica asked. Lila nodded once. I am fine, she said. Monica's eyes searched Lila's face. That is not the same as okay, she murmured. Lila did not answer. Her phone buzzed in her pocket. The vibration was small, almost lost under the noise of the ER, but Lila felt it like a pulse against her thigh. She did not reach for it immediately. She waited until she was out of sight lines, then slipped her hand into her pocket and looked down without lifting the screen fully. A message preview glowed. We need to talk. It is about what you left behind. Lila's fingers went still. She did not open the message. She did not respond. She slid the phone back into her pocket and stood there for a beat, listening to the hospital's hum, the rain tapping the windows, the distant shout of reporters muffled through glass. Then she walked back toward the nurse's station, shoulders squared, hands steady as if she could outwalk the past by refusing to look at it. The first hint of morning began to thin the darkness outside the windows, turning the rain from black to gray. Morning thinned the darkness outside the glass like someone had turned the world down from emergency to evidence. Rain still fell, but it had lost its bite. The parking lot looked washed clean, tire tracks faint in the wet sheen, the hospital entrance no longer dramatic under night lighting, just a set of doors that had watched too much and never blinked. Inside Tidewater Memorial, the ER kept moving because it always did. Shift change brought new faces, and tired eyes clipped greetings, coffee cups clutched like lifelines. The monitors still chirped, the phones still rang, The smell of antiseptics still sat on the air. But the space felt different, as if everyone had learned overnight that rules could crack under pressure and show what was really underneath. Lila stood at the nurse's station in fresh scrubs someone had handed her from supply hair, pulled back tight. Badge still clipped to her pocket because no one had been brave enough to ask for it yet. She logged vitals like she belonged there. Her hands were steady now. The tremor had retreated, not gone, just hidden deeper. A nurse across from her glanced up, then down again, then up once more, like she could not stop checking that Lila was real. "You're still here," the nurse said finally. Lila kept her eyes on the screen. "People still need care," she replied. The nurse's mouth parted, then closed. She nodded as if that settled something she had been fighting with since midnight. A gurney rolled past, pushed by a tech with a bruise blooming on his forearm. He slowed when he saw Lila, then kept going, gaze fixed straight ahead. People did that when they felt ashamed, but did not know how to apologize without admitting they were wrong. Down the hall, Director Keenan Rowe stood outside his office with legal counsel tie, crooked eyes bloodshot. A man in a gray suit spoke in a low voice while Rowe nodded too fast. "It is about perception," the lawyer said. Rowe rubbed a hand over his face. "Perception," he echoed, tired and thin. Behind him, Dr. Malcolm Creed leaned against the wall, arms crossed, jaw clenched so hard the muscles in his cheek twitched. He watched the passing staff like they were all quietly betraying him by existing. Creed had built his authority on certainty. Last night had introduced uncertainty like a contaminant. A hospital administrator held a tablet and scrolled through messages with a tight expression. She stopped once, looked up at Rowe, then back down again without speaking. The silence said enough. Near the entrance, Elias Harlan sat upright, in his wheelchair cap in his lap, posture straighter than it had been when he arrived. Ranger lay at his side, bandage clean wrap, secured eyes alert. The dog's breathing had eased. The tension in his shoulders had softened into something that looked almost like rest. A pair of young sailors stood a respectful distance away, waiting with a transport form. They kept their hands to themselves, their voices quiet. They looked like men who had rehearsed this kind of patience in places where impatience got people hurt. Monica approached Elias with a paper cup of water and a small packet of crackers. "Here," she said gently. Elias accepted it with a nod. "Thank you." Monica hesitated, then looked down at Ranger. "He doing all right?" Ranger's ears twitched at her voice, then settled. Elias's gaze softened. "He will be," Elias replied. Monica's eyes flicked toward Lila at the station, then back to Elias. "She's something," Monica said quietly, as if speaking too loudly might change the truth. Elias followed her gaze and nodded once. "Yeah," he said, "she is." Lila finished her charting and stepped away from the station. A junior resident, cheeks flushed, blocking her path like he had been rehearsing the courage for hours, lifted his chin. "Bennett," he said. Lila stopped. Her expression stayed neutral. The resident swallowed hard. His eyes darted briefly to the corridor where Creed stood, then back to Lila. "I was wrong," he said. Lila studied him for a moment, reading him the way she read patience. Fear behind the eyes. Shame behind the posture. "You were scared," she said. The resident's throat worked. "You weren't." Lila's voice stayed quiet. "I was," she replied. "I just did not let it choose for me." The resident exhaled, shoulders dropping, as if her honesty had given him permission to stop pretending. "I am sorry," he said again, softer. Lila nodded once. "All right," she replied. He stepped aside quickly, as if staying longer might make the moment worse. As Lila walked past, she heard him let out a breath that sounded like relief. At the end of the hallway, Admiral Grant Mercer waited without cameras, without a crowd, without the convoy's theatrics. He wore his posture the same way, but something about the morning made him look less like a force and more like a man who had slept too little. His eyes tracked Lila as she approached, then shifted briefly to Rowe and Creed, then back. "They are standing down," Mercer said when she reached him. Lila did not ask who, she knew. "No charges," Mercer added. "No forced recall." Lila held his gaze. Gaze. That is not mercy, she said. Mercer nodded once. No, he replied, it is recognition. Lila's jaw tightened slightly. Recognition can change. It can, Mercer said. But it holds for now. They stood in the corridor while the hospital moved around them, staff stepping aside without being told to. A nurse hurried past, then slowed, looking at Mercer, then at Lila, as if trying to place what she was seeing into a category that made sense. Mercer's attention shifted down the hall to where Ranger lay. "How is he?" he asked. "Better," Lila replied. "Stable enough for transport. He needs controlled rest and follow-up." Mercer nodded. "It will be handled," he said. Lila looked toward Elias, watching him speak quietly to Ranger. Elias's hand rested on the dog's shoulder with the same steady contact Lila had used. Not owning. Anchoring. Lila's chest tightened, then steadied again. Rowe appeared at the end of the corridor, breaking away from his lawyer. He approached with a face that tried to arrange itself into professionalism, but kept slipping. He stopped a few feet away from Mercer and Lila, careful not to crowd, cautious now, in a way he had not been in the night. Admiral Rowe said. Mercer did not move. "Director," he replied. Rowe's gaze flicked to Lila. "Nurse Bennett," he said, then cleared his throat. "Your termination is rescinded." The word rescinded sounded like a bandage Rowe wanted to slap over a wound he caused. Lila turned her head slowly. "I do not want it rescinded," she said. Rowe blinked. His mouth opened slightly. "Excuse me," he managed. Lila's voice stayed calm. "I broke your protocol," she said, "and I would do it again." A few people nearby slowed without meaning to, drawn by the gravity of the exchange. Monica paused at the corner with a chart in her hand, eyes fixed. Rowe's face flushed. "You acted without authorization," he said, reaching for the phrase like it could stabilize him. Lila met his gaze. "I acted with judgment," she replied. Rowe's jaw worked. He glanced toward Mercer as if hoping the Admiral would solve this for him. Mercer did not step in right away. He watched Lila the way he watched the entire room, letting the truth stand on its own. Rowe swallowed. "Then what do you want?" he asked, and the question sounded less like negotiation and more like desperation. Lila's eyes moved past him to the waiting room beyond, where a man with a coughing fit held a paper mask over his mouth, where a mother rocked a tired child, where a teen stared at the floor with a wrist wrapped in gauze. People who had no medals, people who had no rank, people who still needed care. "I want to work where compassion is not treated like a liability," Lila said. Rowe stiffened. "This hospital has standards," he said, voice thin. Lila nodded once. "So do I," she replied. Rowe's lawyer stepped forward as if to interrupt, then stopped when Mercer's gaze turned toward him. The lawyer's mouth closed. He stepped back. Rowe's voice softened into something that tried to sound reasonable. "You can keep your job, and we can review policy," he said. "We can address what happened, but refusing reinstatement is not practical." Lila's expression did not change. "Practical is how you justified leaving him in pain," she said quietly. Rowe's face tightened. "We had to protect staff," he insisted. Lila looked at him for a long moment, then spoke with a steadiness that made the words feel heavier. "Protect them by teaching them," she said, "not by pushing problems outside." Rowe's throat worked. He nodded once stiffly as if agreeing hurt. Creed stepped forward, then unable to keep silent, his voice sharp with defensiveness. "You are making this personal," he said to Lila. "You put people at risk." Lila's eyes slid to him. "You saw pain and called it threat," she replied. Creed's jaw clenched. "You do not get to lecture me," he snapped. Mercer's voice cut in calm and flat. "She does," he said. "Tonight she acted. You refused." Creed's face flushed deeper. "We did not refuse care to the patient," he said. "We refused to treat an animal." Mercer held his gaze. "You refused to provide interim relief," he replied. "You refused to coordinate. You refused to adapt. If your department cannot handle a working partner without panic, then your department is not as competent as you pretend." Creed's mouth opened, then closed. He looked away first. Roe shifted his wait eyes, darting again as if he could feel the building watching him. Lila turned away from Roe and Creed without drama. She did not need a victory. She needed to finish what she had started. She walked back toward triage and checked on a patient in the corner who had been waiting since midnight. She refilled a supply bin with gauze. She helped a new nurse tape an IV line that kept slipping. She moved through the ER like a professional closing a shift, not a person staging a departure. Monica fell into step beside her near the supply closet. "Are you really leaving?" Monica asked. Lila did not stop moving. "I am leaving this job," she said. Monica's eyes flicked to the badge. "They can make it right," she said quietly. Lila's voice stayed low. "They can make paperwork right," she replied. "That is not the same thing." Monica swallowed hard. "Where will you go?" Lila glanced at her, then back to the hall ahead. "Somewhere smaller," she said. "Somewhere that does not confuse rules with care." Monica nodded slowly, as if she understood more than she could say. "You will be missed," she said. Lila's mouth moved slightly. Not a smile. Something softer. "Take care of yourself," Lila replied. Monica's eyes glistened. She looked away quickly and pretended to be busy with a cart. Near the entrance, Ranger lifted his head when Lila approached. His ears rotated toward her. His eyes held hers. The dog's body remained still, but his tail moved once, controlled a single beat like a signal. Elias looked up. "You are still moving, like you belong here," he said. Lila stopped beside the wheelchair. "I belong to the work," she replied. Elias nodded slowly, then glanced toward the doors, where the rain had thinned to a mist. "Transport is ready," he said. Two sailors stepped closer. One held a folder. The other kept his hands respectful eyes on Ranger. Elias looked at Lila again. "You never asked," he said. Lila shook her head. "I did not need to," she replied. Elias's mouth twitched the hint of a smile that carried tired gratitude. "That used to be enough," he said. Lila reached down and placed her palm gently on Ranger's head. The dog leaned into her touch. The trust was quiet. It did not perform for anyone. It did not need witnesses. "You did good," Lila murmured. Ranger's eyes softened for a fraction, then returned to alertness. Working dogs did not stop working just because the pain eased. They simply held the line with less strain. Mercer approached, then stopping a respectful distance away. His eyes moved from Elias to Lila. "You are choosing again," he said quietly. Lila looked up at him. "I always do," she replied. Mercer nodded once. "You always did," he said. Elias watched them both with a knowing look. "You two talk like it is not the first time," he said. Mercer's mouth tightened slightly. "It is not," he replied. Elias gave a small sound that might have been a laugh if it had more air in it. "Figures," he said. A hospital volunteer pushed a cart of blankets past them, slowing as she recognized the dog and the wheelchair, then speeding up again, uncertain whether she was allowed to look. Roe hovered near his office, watching the scene with a face full of exhaustion and calculation. He took a step forward, then stopped as if unsure whether speaking again would make things worse. Lila did not look at him. She did not need to. When the sailors moved the transport chair into place, Elias reached down and touched Ranger's harness. "Up," Elias said. Ranger rose carefully, favoring the injured leg, but steady. The sailors stayed still, giving the dog space. Ranger stepped beside Elias and sat again, disciplined, even on medication eyes scanning the corridor. Elias lifted his chin and looked at Lila. "You saved him," he said. Lila shook her head. "He trusted me," she replied. Elias's eyes softened. "That is harder," he said. Lila felt her throat tighten, then forced it steady. "Get him healed," she said, voice quiet. Elias nodded. "We will," he replied. Mercer watched as the transport team prepared to move out. He lifted a hand to Elias in a small gesture of respect. Elias returned it with a clean salute, precise despite his age. Ranger sat tall beside the chair and held still as if the salute belonged to him, too. The convoy was no longer parked like a threat outside. It waited like support. The engines were quiet now. The morning had taken the edge off the night's power. Lila turned away and walked down the hall toward the lockers. The corridor felt longer in daylight, less dramatic, more honest. She stopped at her locker and opened it. Inside, where the small pieces of a life lived in short shifts, a spare pen, a packet of gum, a folded set of gloves, a worn notebook with notes written tight and precise. She pulled them out, one by one, and placed them into her bag. She did not rush. She did not linger either. She simply cleared the space as if finishing a task. Behind her, a footstep paused. Monica stood a few feet away, arms folded loosely, eyes searching Lila's face. "You are really going," Monica said. Lila closed the locker gently. "Yes," she replied. Monica's voice dropped. "They are scared of you now," she said. Lila looked at her. "They were scared of the dog," she replied. "Fear is not new." Monica swallowed. "Be careful," she said. Lila nodded once. "Always," she replied. Monica hesitated, then stepped forward and held out a small card, a number written on it. "If you ever need," Monica began. Lila took the card without comment and tucked it into her notebook. "Thank you," she said. Monica's eyes glistened again. She turned away before it showed too clearly and walked back toward the nurse's station. Lila slung her bag over her shoulder and stepped out of the locker room. As she walked toward the exit, she passed Roe's office. Roe stood in the doorway alone. Now lawyer gone Creed, nowhere in sight. Roe cleared his throat. "Nurse Bennett," he said. Lila stopped. She did not turn fully. She waited. Roe's voice sounded rougher than before. "I did not know," he said. Lila's eyes stayed forward. "You did not ask," she replied. Roe's jaw flexed. "We have policies," he said, weaker now, like he was saying it to convince himself. Lila turned her head slightly, just enough that he could see her expression. "Then make one that helps," she said. Roe's mouth opened, closed. He nodded once, stiffly. Lila continued walking. At the front entrance, the rain had thinned to a mist, the air cool and sharp. Elias was already being guided toward the transport vehicle. Ranger stayed close, limping but calm. Mercer stood near the curb, hands at his sides, watching with the quiet attention of someone who made sure the right people got out clean. Lila stepped under the awning. Ranger's head turned. His eyes met hers one last time. The dog held her gaze, then looked back to Elias' duty, reasserting itself. Lila lifted her hand slightly, not a wave, just a small acknowledgement. Elias saw it. He nodded once, then turned his attention forward as the transport team moved him up the ramp. Mercer watched Lila approach. "You will be missed by the ones who matter," he said. Lila's voice stayed even. "The ones who matter will keep working," she replied. Mercer's mouth twitched slightly. "You always did know how to disappear," he said. Lila met his gaze. "You always did know how to arrive," she replied. Mercer exhaled a low breath that sounded like he had been holding it since the agents walked in. "You did not answer that message," he said, not a question. Lila's fingers tightened around her bag strap. "No," she replied. Mercer nodded once. He did not ask more in public. He understood what questions cost. A door closed on the transport vehicle. The engine started low and controlled. Ranger was visible through the window for a moment, sitting tall beside Elias. Then the vehicle rolled forward. Mercer watched it pull away until it cleared the lot. Lila stood beside him, feeling the hospital behind her, like a weight she had set down and could still sense on her shoulders. Mercer reached into his pocket and pulled out his phone. He typed a message with his thumb, short and precise. He did not show her the screen. He did not need to. He slipped the phone away and looked at her. "You will do what you do," he said. Lila adjusted her bag on her shoulder. "Yes," she replied. Mercer held her gaze for a beat, then stepped back, giving her room to leave. Lila walked across the wet pavement toward the edge of the lot where the street began, and the hospital lights stopped trying to make everything look clean. The mist clung to her hair. Her shoes made soft sounds against the damp concrete. She did not look back at the glass doors, not because she was angry, because looking back was a kind of permission. Her phone buzzed once inside her pocket. Lila did not take it out. She kept walking steady quiet, carrying nothing but her bag and the kind of calm that could not be taught in orientation.